Good evening, everyone. Today, the topic of our presentation is Lorazepam. Lorazepam is a short-acting benzodiazepine medication that is commonly used to treat anxiety disorders and insomnia. It works by enhancing the effect of Gaba, a neurotransmitter in the brain that helps to regulate mood, emotions, and sleep. The drug lorazepam was first developed in 1963 by D.J. Richards and was approved for the use in the United States in 1977. Chemical structure. Lorazepam is a benzodiazepine ring that consists of a central benzene ring fused with a diazepine ring. It also contains a methyl group on the nitrogen atom of the diabenzene ring, which contributes to its pharmacological activity. Moreover, the molecular formula of lorazepam is C15H10Cl2 N2 and O2. Mechanism of action. Lorazepam allosterically binds on the benzodiazepine receptors in the postsynaptic GABA-A ligand-gated chloride channel in different sides of the central nervous system. This binding will result in an increase in the inhibitory effect of GABA. This leads to a decrease in the activity of certain neurons in the brain, producing the sedative, hypnotic, anxiolytic pharmacokinetics of lorazepam. The effect of lorazepam in GABA-A receptors produces increase in the frequency of opening of the chloride ion channel. However, for its effect to generate, the neurotransmitter is required. The anticonvulsant properties of lorazepam are thought to be related to the binding to voltage-dependent sodium channels, in which the sustained repetitive firing gets limited by the slow recovery of sodium channels. Due to the benzodiazepine effect, the effect of lorazepam seems to be very compartmental, which was observable with a different generation of sleepiness and dizziness effect. Absorption. Lorazepam is rapidly absorbed after oral administration, with peak plasma levels occurring within 2 hours. The next one is distribution. Lorazepam is highly bound to plasma proteins and is distributed throughout the body, including the brain and nervous system. Binding. Lorazepam binds with a high affinity to the GABA-A receptor, leading to an increase in the inhibitory effects of GABA in the brain. Metabolism and elimination. Lorazepam is metabolized in the liver by phase reactions and is eliminated from the body largely by renal excretion. The half-life of lorazepam is approximately 10 to 20 hours. Clinical uses of lorazepam. The first one is anxiety disorders. Lorazepam is commonly used to treat generalized anxiety disorder, panic disorder, and social anxiety disorder. The second one is insomnia. Lorazepam can be used to treat insomnia, particularly when it is associated with anxiety or an acute stressors. Seizure disorders. Lorazepam is also used as an anticonvulsant medication to treat fits or seizures. The last one is its other uses. Lorazepam may also be used to manage alcohol withdrawal symptoms, induce sedation for medical procedures, or treat muscle spasms and restless leg syndrome. Adverse side effects of lorazepam. Short-term effects. Lorazepam can cause drowsiness, dizziness, confusion, and impaired coordination in the short term, particularly at higher doses. It may also cause gastrointestinal symptoms such as nausea, vomiting, and diarrhea. Long term effects. Long-term use of lorazepam can lead to physical dependence and tolerance, increasing the risk of withdrawal symptoms and addiction. It may also cause cognitive impairment, memory problems, and an increased risk of falls and accidents in the elderly. Chemistry of lorazepam. Classification. Lorazepam is classified as a benzodiazepine ring, which means it shares a common chemical structure with other drugs in this class. Properties of lorazepam. Lorazepam is a white or almost white crystalline powder that is springly soluble in water. It has a molecular weight of 321.2 gram per mole, and its molecular formula is C15H10Cl2 N2O2. Interactions with other drugs and substances. Drug interactions. Lorazepam may interact with other central nervous system depressant medications such as alcohols, opioids, and antihistamines to increase the sedative effects of the drug. Its examples include abacavir. Lorazepam may decrease the excretion rate of abacavir, which could result in a higher serum level. Another example, 1,2-benzodiazepine. The risk or severity of central nervous system depression can be increased when lorazepam is combined with 1,2-benzodiazepine. Another example is of bromothiophylline. The therapeutic efficacy of lorazepam can be decreased when used in combination with bromothiophylline. Substance abuse. Lorazepam has potential for abuse and addiction, particularly when used in higher doses or for longer period of time. Recent research on lorazepam. Effects on memory. A study conducted in 2016 found that lorazepam can impair certain aspects of memory in older adults, highlighting potential risk associated with benzodiazepine use in this population. Another research is on withdrawal symptoms and dependence. Research has shown that, like other benzodiazepines, can lead to physical dependence and withdrawal symptoms, particularly with longer use or higher dosages. Therapeutic uses. Lorazepam is used to treat anxiety, insomnia, alcohol withdrawal, and seizures, and is sometimes administered before surgery to relax patients. Analytic methods. The first one is characterization. Analytic methods of characterization are as follow. NMR spectroscopy. Nuclear magnetic spectroscopy can help identify and analyze the chemical structure of lorazepam as well as other benzodiazepines. The second method is mass spectrometry. Mass spectrometry, abbreviated as MS, can help identify the molecular weight of lorazepam as well as detect any impurities or contaminants present in a sample. FTIR spectroscopy. Fourier transform infrared spectroscopy can help identify the functional groups present in lorazepam as well as other compounds. The next analytical method is identification. The first method of identification is HPLC, which stands for high pressure liquid chromatography. HPLC can help identify and separate different components in a sample based on their properties such as polarity or size. The second method of identification is GCMS, gas chromatography and mass spectrometry. GCMS can help identify and analyze the chemical composition of a sample and is often used in forensic and drug testing contexts. The last analytical method is quantification. The first method of quantification is UV spectroscopy. UV spectroscopy can be used to quantify lorazepam present in a sample by measuring the amount of light absorbed at a certain wavelength. The second method is high performance liquid chromatography. High performance liquid chromatography can be used to quantify lorazepam based on its concentration, with sensitivity depending on the detector used. Nuclear magnetic resonance spectroscopy. NMR spectroscopy can be used to quantify lorazepam in a sample by measuring the intensity of certain peaks in a spectrum. Future directions. Further research is needed on the long-term effects of lorazepam use. as well as on potential alternative treatment for anxiety and related conditions. Improvement in analytic methods will continue to advance the field of drug development and testing. Conclusion: Lorazepam is a valuable medication that can be used to treat a variety of medical and mental health conditions. However, it also has potential risks and side effects that should be carefully monitored by healthcare providers and patients alike. Thank you.